Good afternoon. This is Dr. Nidhi Gupta. I'm talking about my poster on retrospective review of 4 factors associated with transfemoral prosthetic use at and beyond 1 year at tertiary center in Australia. So, amputee services assess transfemoral amputee patients prior to their prescription to those most likely to be functional prosthetic users. There is limited research on long-term transfemoral amputee prosthetic use, with focus of the research being on clinical factors, for example, wound healing, post-amputation pain, prosthetic fit, health of the patient affecting prescription of prosthesis, and they use screening tools for these. The case numbers are often small, and often it's a mixed transtip and transfemoral amputee cohort. So the aims of our study were twofold: to look at the success or otherwise of current approaches to transfemoral amputees in prescription at and beyond 1 year of amputation, and aim 2 was to determine demographic and social factors that modified functional outcome. So this was a retrospective cohort study of a 6-year data of 2015-2020 at Metropolitan Tertiary Hospital in New South Wales, Australia. The data was collated from electronic medical records, rehabilitation medicine database, and affiliated prosthetic company. The outcomes of interest were frequency, which was daily and not daily, and duration of prosthetic wear, which was divided into less than 4 hours and more than or equal to 4 hours a day. The data was analyzed using descriptive stats, using multiple regression analysis, and adjusted for clinical and social characteristics. The inclusion criteria included all patients who had a transfemoral amputation, who were prescribed a prosthesis, and who had attended follow-up at least 1 year post-amputation at the hospital and at the amputee clinic, and had prescribed a prosthesis. The results showed that there were 63 patients over a 6-year period with a mean age of 48 years, with a range from 7 to 80 years of age. The demographic data is shown in table 1, where you can see the 53 out of 63 were males, and 50 out of 63 were English speaking, and almost half were living at home with a partner, and again, almost half were traumatic amputees. Majority were half were K2 ambulators, and the other half were K3, K4 ambulators. So majority of the transfemoral amputees were using the prosthesis at and beyond 1 year, with 85% wearing the prosthesis every day, and 76 wearing it at least for 4 hours and more a day. So the factors associated with increased frequency and duration of wear were younger age, higher K rating on training, mobilizing with nail aids after K training with physiotherapy, and being employed post-amputation. Then the traumatic amputees and those living at home wore the prosthesis daily, but not for longer duration, while availability of formal services and absence of comorbidities was increased duration of prosthetic wear. The presence of a partner or informal support and post-op complications were not associated with prosthetic wear at all, as you can see in table 2 and 3. So in conclusion, the majority of transfemoral amputees wear the prosthesis daily and for long periods of time, at and beyond 1 year of amputation. And a higher K rating, younger age, and independent mobility and discharge are clinical factors associated with more use. Post-operative complications, especially delayed wound healing, did not affect the prosthetic wear. Thank you.